For this lesson, it's optional to use a small towel or a washcloth. Go ahead and lie down on your back on a rug or on a yoga mat. And let's begin by closing our eyes and coming inward and simply noticing how our body is feeling today. Like always, if you have any low back tightness or pain, go ahead and bend your knees and notice what part of your back is the closest to the ground. The right or the left, the upper, middle, lower. And what part is the most lifted from the floor? Do you have any jaw or neck tightness? Are you tensing and holding anywhere? Go ahead and bend your knees and stand your feet about a hip's width apart, and make sure your feet and your toes are pointed away from you. Find a comfortable distance for your feet where it's a power center. And optionally, you could take the little towel roll it up how I have it, and place it under the small of your back. And then do very small micro pelvic tilts. Now, a pelvic tilt is a roll as opposed to a lift. So go nice and slow. Just do 4 or 5. And then take the roll away. And you could take a rest with your knees long or your knees bent. And now go ahead and bend just your left knee. And you may want to position your foot and knee just about a half an inch to the left. And you're going to keep the knee pointed towards the ceiling so the knee does not move. And what we're going to do now is we're going to imagine pushing the floor away with the left foot and gently off weight the left side of the pelvis so that your weight rolls to the right. And as it does so, it makes a diagonal across the floor from the left pelvis to the right shoulder. Do this just a few more times. And making sure that anytime you do any of these micro movements, your muscles stay relaxed. You stay out of your thinking mind. And now switch legs. So go ahead and first position your right foot, and gently push the floor away with the right foot, very gently off weighting the right side of the pelvis. So this is a one-legged pelvic tilt. And you may feel a diagonal line being drawn on the floor between the right hip and the left shoulder blade. Do it a couple more times. And then take a rest. And once again, you could retest the rolling of your head. Roll your head once to the right and once to the left, and see if there's a difference now. And then take a full rest. And now go ahead and bend both knees. We're going to combine the motions. We're going to start with pushing through the left foot and feel that diagonal line being drawn across the floor from the left hip to the right shoulder, and vice versa. So imagine an X being drawn across the floor. And this is optional if you want to roll up a towel roll and place it under the small of your back. And I realized that the first time it might have been a little bit too thick. So this time I'm going to have it be less thick. And now what I'm doing is just a simple pelvic tilt, just as we did initially. Pushing the floor away just enough to roll up the tailbone just ever so slightly. And you'll see that my spine moves ever so slightly upwards. And if you're holding your jaw or if you're holding in your chest, that's going to limit the movement of the upward and the downward. So it's like pulling your spine downwards, your pelvis is, which is similar to traction, and then pushing it upwards. This is very soothing on the nervous system. It calms, it relaxes. Now take a pause with your knees bent, just keep them there. And now we're going to combine the movement of pushing through your right foot and then pushing through your left foot. So you're going to alternate pushing through one foot at a time. And as you're doing this, feel the X go from a diagonal from one hip to the other. Do it a couple more times. And let's go ahead and take that towel whirl away. And let's come back to the simple pelvic tilt. You want to do a pelvic tilt in a way that you could do this for an hour without getting tired. So if you're forcing it or pushing it, then that is anti-Feldenkrais way to do it. So you want to do it the Feldenkrais way, is with ease, effortless, learning new ways to move. And just pause with your knees bent right now. Take a pause, take a rest. And notice if you notice any differences in how your back is making contact with the floor, how your breath is more full and expansive. And then I'd like you to roll very gently to the right. And you're going to use your upper right arm and your left hand to push yourself up using your pelvis as the fulcrum. So go ahead and push yourself up to sitting. And take a moment, you could take a moment in sitting and just feel if you feel more symmetrical, more balanced. And you might even also notice that your head feels like it's carried as you walk. Go for a walk around the room. What's the difference that you feel in your body? From just this 5-minute Feldenkrais lesson, do you feel more aligned, more balanced, more symmetrical? And do you have more ease with rotating your head to the right and to the left? And also, while you're in standing, go ahead and one more time rotate your head to the right and to the left. And notice if you feel more parts of yourself coming along, like more parts of your vertebra. Not only your cervical vertebra, there are 7 cervical, but you have 12 thoracic, which is from where your neck connects into your shoulders and your torso. So feel as you take your head to the right and the left, if you feel any of these muscles coming along for the ride. Stay healthy and happy.